It is a pleasure to be with you today from Washington, D.C., land of milk and honey, land of all answers, all solutions. It is amazing that this many people would come out to talk about healthcare and politics, on a weekday morning like this. But then I thought, oh, that's right, I'm in Wisconsin, where you eat politicians for breakfast, so... you've been at the epicenter of political stuff for many, many months now, so it's not a surprise that you might want to come out and talk about health care reform. Just don't do to me what you do to those guys, okay? Just be nice to me today. I'm not here to represent any particular point of view. In fact, I try to tell it just basically the way it is. I'd tell you right up front a couple of things, just because there's three things that I want to tell you this morning, just to help you understand a little bit from my background, what perspective I might have on all of this. The first is that I'm a small business owner. Strategic Healthcare I started 17 years ago. I've got 60 employees in a couple of states and in Washington. And so I understand what it means to make payroll and how difficult that can be sometimes. I understand what it means to review my health insurance plans, every year and see all the increases that the insurers are saying I'm going to have to pay the next year and how to deal with all that kind of stuff. So I've been doing that a long time. The second thing I want to tell you is that I'm a Republican. Now, I tell you that because in the presentation that I make, you may be thinking, oh, that guy is just a big liberal Democrat. Or you might say, oh, he doesn't care about people or whatever. I want to let you know where I come from politically, so you know right up front on this. Now, when I say Republican, I want to say that I'm something like a raging moderate or a flaming pragmatist. So my politics is really about getting things done personally. And the last thing I want to let you know is, in addition to running Strategic Healthcare, I'm also a lobbyist. Nobody even picked up anything. I thought, I was just waiting for somebody to throw something, but I do spend a lot of time on Capitol Hill working with our politicians, your congressional delegation. Politics is not the same today as it was. I started in this business about 30 years ago and working on Capitol Hill for a U.S. Senator. And one of my favorite all-time politicians, without a doubt, William Proxmire. How many remember William Proxmire? What a guy. His last re-election, and I knew him because his last term in Congress was my boss's first term in Congress. And Proxmire in his last re-election, as I recall, spent about $15 or $20 to get re-elected. An amazing man, really understood, I think, this state very, very well, served, not only this state, but the nation very, very well. Well, politics is a lot different today than it was when Senator Proxmire was in office, significantly different today. It is truly ugly out there. There's no question about it. Wisconsin is, like I said, is the center of all that, not necessarily ugliness, but it's the center of a lot of the things going on in America today that are different and challenging. So you go in and you vote to send these guys, these men and women, to Washington. Most of them now are probably on average 40 years old and a lot younger on average than they have been in a long time. And you tell them to go do stuff in D.C. to represent your interests. And as you'll see in the discussion this morning, the challenges that they face going to Washington are twofold. On the policy front, the answers that they have to come up with are daunting, very, very difficult. And I'll get into a little bit about the Ryan budget, for example, another great person from Wisconsin. Very, very challenging today, the decisions that they have to make. And two, the environment in which they work, the political environment in which they work today is unlike at any other time in modern American political history. It is, you read history books about how nasty things were in presidential campaigns maybe in the mid-1800s. Things are really nasty. Well, they're nasty again, and they have been for some time. I recall in the early 1980s, it was very common for a Republican and a Democrat in the United States Senate, after a day at the office, maybe a fight on the Senate floor over some issue, could go out and actually get a drink together after work, be seen in public together, actually. I'm not talking about a man and a woman, I'm talking about a Republican and a Democrat. You can't do that anymore. You can't really be seen with members of the opposite party in social settings unless it's a sanctioned event, because people talk, and that's not right, which is a very sad situation. I told a story just striking about how difficult it is, the environment to work in. So we have a home on Capitol Hill that we use for a lot of events where we do host fundraisers and stuff like that for politicians. And about 18 months ago, we were hosting an event for a young congressman, a Democrat from Cincinnati, and he was walking. I was on one side of the street, he was on the other side of the street, and literally out of nowhere, this young guy pops out with a video camera in his hand. You know those little video cameras. And he got about 18 inches away from the congressman's face and is walking backwards, yelling at him questions like, "Congressman, do you promise your constituents that you will read every bill before you vote on it on the House floor?" There was some particular piece of legislation in particular that he was mentioning that morning. And the congressman lied and said, "Yes, I read every bill before I vote on it." But he was being badgered all the way up to the House. And so we got in the House, and I said to the congressman, "What news organization was that kid with? You know, some, internet whatever." And, "Oh, no. He wasn't with a news organization. He was a Republican tracker, and the Democrats have them as well. The parties hire these kids, give them cameras, send them out all over the country to try to catch these guys and badger them to say something stupid, say something profane, say something that they can put on the internet, or if it's really good, put it in a campaign commercial." That's the environment that they work in. Imagine you going to work every day, having to worry about some guy jumping out of the bushes, with a video camera. That's the environment they work in. So you've got the policy, difficult issues related to policy, and then you've got the political environment. So you can understand why things are not as rosy, as wonderful as you might hope they would be in Washington, D.C. So it definitely is very ugly. One of the other things that makes it difficult, I don't know if you can see this in the back of the room. Can you read those numbers back there okay? The fact is that we're a divided government. The Republicans control the House. As you can see here, they control it substantially after the last election. And the Democrats control the Senate. But the most important thing about the United States Senate is not necessarily who's in control, but who can get 60 votes. The filibuster rule has been around for more than a century. But the way that it's used today is many members of Congress, if they don't like something, they say, "Okay, I'm going to filibuster that, whatever that might be." To stop a filibuster, you need 60 votes. After the election in 2008, the Democrats had 60 votes for a very brief period of time until Senator Ted Kennedy died. And even then, it was hard to get all 60 Democrats together on any particular issue. When they had 59 votes, it became increasingly difficult. In fact, the health care vote specifically in the beginning of 2010, they had to get a couple of Republican votes to actually pass that in the United States Senate. So to do anything in Washington, it's not just the fact that the Republicans control the Senate and the Democrats control the House. You can't move anything through the Senate without 60 votes, and it's very difficult to get 60 votes on anything. I don't agree with my wife 100% of the time. Imagine trying to get 60 people together trying to figure out yes or no on some issue. It's very difficult to do. And of course, the next major event that we have that's going to test how solid our republic is this debt ceiling vote coming up in May, probably mid-May. Very challenging vote for a lot of reasons. Not going to get into that this morning, but again, it's, all of that is going on in an environment where the economy is not real good and a lot of trouble around the world. We're in 3 wars or something like that, and it's a very challenging time. And on top of that, you got this healthcare thing going on. Before I jump right into healthcare, let me talk about why we're in this situation in healthcare. We need change. I don't think there's any question about the fact that we need change. The question is, what change do we get? Well, there are reasons why we're in this situation. The spending growth that we have right now is unsustainable. The delivery system is broken, the insurance system is broken, and patients can't afford care. A lot of patients can't get care. They don't have coverage at all. And so, now there may be other reasons. You might have 5 other reasons up here why we need change. These are generally regarded in all the polling that's done. These are 4 of the reasons that most Americans say, yep, we need to have change, and these are 4 of the reasons as to why we need change. This is spending growth in healthcare. So in 2010, actually 2011, it's bumped up. It'll bump up a little bit this year, but we're nearing about 18% of GDP is healthcare. Healthcare spending in the United States, $1 out of $5. Almost 1 out of 5 of every dollars in the United States is a healthcare dollar. And a lot of people say, you know what, that's not good compared to other countries around the world. Maybe we're spending too much on healthcare, maybe not. But the point is that a lot of people believe that this rate of growth as a percentage of overall GDP is not sustainable. Because at this rate, in about 20 years, healthcare, or 25 years, healthcare will be 100% of GDP. Of course, that isn't going to happen, but at this particular rate of growth. So what do we do about that? And that's the dilemma that we're facing. Well, what's driving that? Look at Medicare and Medicaid. The blue line is Medicare. The red line is Medicaid. You combine them in 2010, it was a little over $800 billion, Medicare and Medicaid combined. A little over $800 billion. I know that's a big number. It's hard to get your arms around it. 2011, it'll be about $1 trillion, okay? Just about $1 trillion, because Medicaid, because of the economy, more poor people are using Medicaid or going on Medicaid, and so the Medicaid numbers are bumping up. So we'll have about $1 trillion in Medicare and Medicaid this year. What's the federal budget? The total federal budget in 2011, anybody want to take a guess? It's about $3.6 trillion. $3.6 trillion. When I went to Congress with a senator back in 1980, it was under $1 trillion. The whole federal budget that year was under $1 trillion. Now it's $3.6 trillion. $1 trillion of that is Medicare and Medicaid. So when you look at Medicare and Medicaid, Social Security, defense, and interest on the national debt, that's 85% of the federal budget, those 5 areas alone. 85%. Now, how many of your representatives, people you voted for, or other representatives around the country, campaigned in the last election on, I'm going to go up there and cut Medicare, Medicaid, Social Security, and defense, and that'll take care of the debt? Not very many. Not very many. So if we're quibbling about 15% of the federal budget, or that's what's left, like foreign aid, agriculture, health care, apart from Medicare and Medicaid, education, and whatnot, make up 15% of the federal budget. You could cut all of that and still have a very serious debt problem in the United States. You could eliminate all that other spending, and it wouldn't do the job. So this gives you some sense about how daunting the task is that these folks have. So where's the money going in health care? This is just more of an interest than anything else. How is the health care dollar broken up in America today? Professional services, physicians, dentists, and whatnot. The 3 fastest growing areas, though, are the 3 smallest areas right now: nursing home, prescription drugs, and medical equipment. Those are the 3 fastest growing areas on this particular pie chart of where health care dollars are going today. So it's not hospitals and physicians, it's nursing homes in particular. But why? Why? Look at our population. We're an aging population. Those Medicare numbers that you see going up, we're an aging, a graying population. Fastest growing age group in America today are people 85 years and older. That's the fastest growing age group in America today. So it's a problem, and it's growing. These are, by the way, I wasn't sent here just to depress you. Although if you're feeling a little depressed right now, I can understand why. That's not my goal this morning. Maybe this is a sobering moment for you this morning. Not that you needed one, I understand. So who is covered and who isn't? These are some facts and figures which underscore what is some of the charts I just showed. But when you look at the top one, enrollment in Medicare has grown by 32% from 95 to 2010. Again, it's just another way of saying we have a problem. And the numbers, the demographics in the United States are driving a lot of this. It's not necessarily political decisions that are causing the problem, but just the facts of who we are as Americans is driving this issue. And of course, it's easy to cut Medicare. It's hard to cut Medicare benefits for beneficiaries because seniors vote. And so, this continues to drive some of the political debate. Uninsured, the number of uninsured, close to 50 million. Another 20 some odd million are underinsured, meaning they've got some kind of insurance, but maybe they have to cover the first 5,000 or 10,000 out of their own pocket before their insurance kicks in. And there's a lot of that around the United States. So this is trying to demonstrate where we are today and where we're supposed to be on the coverage issue after health care reform. So this slide is a little bit ahead of where it should be in the presentation, but I wanted to show you that we have about 50 million, that's that little pie piece that's cut out there, about 48 million it says, who are uninsured. After health care reform is fully implemented 2019, that drops down to 24 million. But one of the things that you see here is that the number of people in Medicaid today, 59 million Americans is going to grow to 84 million Americans, because that's mostly how we're going to cover people under health care reform, is through the Medicaid program. So there's a lot of things about health care reform that we don't like. One of the things I want to say is, by way of explanation, is that most of the polling today continues to show that a majority of Americans would like to see the health care reform law repealed. It's dropping, though. Every month, those numbers are dropping. It's down now to about 53% say they would like to see it repealed. But also a majority say that it's not going to happen. They don't believe it's going to happen. In other words, get repealed. And a majority also say, so move on to other things. Because, even though we may not like it, a majority may not like it, we think it's probably here to stay. We have to learn how to live with it. That's what the polling is showing today. But what is it about health care reform you don't like? So I ask people who tell me, I really hate health care reform. What is it you don't like about health care reform? What is it you don't like? I hear stuff all over the map in terms of what, various pieces and parts of it. And so what I want to do is just spend a couple minutes on what is in the health care reform law. And the last half of the presentation, I'm going to talk very specifically impact on business, some of the things in the law that people are not necessarily aware of in terms of its impact on large and small businesses. But what is it, generically speaking, that people don't like about health care reform? Well, I listed, based on a lot of the polling that's done on this, these 5 areas. Taxes. It increases taxes by $569 billion over 10 years. Now, that's not the general tax rates that all Americans pay. These are taxes on particular entities. For example, insurance companies, health insurance companies in particular, bear the greatest amount of tax in that number right there. Of course, the reason the taxes were increased on various components of the industry is because they're using these dollars to help fund the health care reform initiative, the health care reform law. So they needed to find revenue to do it, and this is one of the ways they did it. So they increased taxes on insurance companies. Of course, a lot of you say, well, you increase taxes on insurance companies, that means ultimately we're going to pay it, because the insurance companies are just going to pass that along to those of us who are paying the premiums or paying for it. And you're absolutely right. There's taxes on medical device companies. There are a variety of different kinds of taxes that are not general tax increases. They are taxes on parts of the industry. And of course, those taxes, for the most part, are going to get passed along. Simultaneously, there are cuts to health care providers. The largest cuts are happening to health insurance companies. They bear, out of the $530 billion over 10 years in cuts, health insurance companies have the largest amount of those taxes, close to $200 billion of cuts. Close to $200 billion. Medicare Advantage plans are going to be cut about $200 billion over 10 years. Then the next largest group is hospitals, $155 billion over 10 years. It was a deal that was agreed to by the hospital industry through their associations in Washington. Pharmaceutical companies, $80 billion. So you add all this up, and it amounts to about $530 billion in cuts, in actual Medicare reductions. Now, one of the things that is, again, it's all fairly misleading, and of course that's what politics is today. Maybe it's always been like that, fairly misleading, and that is the ads that you see say, well, if you voted for health care reform, you voted to cut Medicare benefits, or Medicare for seniors. They don't say benefits. Medicare for seniors, you voted to cut that. That's not the case. There are 0 cuts to beneficiaries. 0. All the cuts are to provider organizations. None to the beneficiary. And that's a significant point, because when you're trying to separate what's true and what isn't in healthcare reform and the law and all this, it's helpful to understand the minutia of these facts. Who's taxed and who's cut? Employers. Employers are required to provide health insurance to their employees. And then there's a lot of caveats to that. I'm going to talk about a few of them in a few minutes. But generally speaking, that's one of the reasons why employers aren't real happy with health care reform, because if you weren't or didn't have to provide that coverage for your employees, now you do. If you don't, if you decide, no, I'm not going to do that, you pay a penalty. Those penalty dollars go to help pay for health care reform. And then the individual, all Americans. Let me make one parenthetical point here, is that because I get this everywhere I go, there is nothing in health care reform to support financially in any way, shape, or form health care for illegal aliens in the United States. That is not in this bill. It is not in there in any way, shape, or form. That doesn't mean they don't get health care. It means they walk into a hospital emergency department and the first question is not, are you an illegal alien, in the United States or undocumented? No, they get care. And we all pay for that, and we have forever. All of us pay for that through cost shifting. But there is no provision in the health care reform law for undocumented or illegal aliens in the United States. So the individual mandate, though, all Americans are required to have health insurance. All Americans are required to have health insurance, except if you don't want to. And if you don't want to, then you're penalized. You pay a penalty. I'll talk about that in just a minute. And then spending. The health care reform law doesn't, on the surface anyway, do a lot to rein in health care spending. Now, there are cuts. I mentioned, that there's about $530 billion in cuts, but spending continues to rise in health care reform. However, there are a variety of provisions in the health care reform law which are designed to change the way health care is delivered in the United States dramatically. I'm not going to go into that this morning. You're not perhaps as interested in that from your perspective, but there are, if anybody says health care reform didn't do anything to change the healthcare delivery system and the behavior of healthcare providers like physicians and hospitals and everybody else, that is not true. There are a lot of things in healthcare reform, significant things. And I'll just give, just because I'm thinking of it right now, there are 3 things in particular. For example, for your hospital, as a case in point, hospitals are going to be penalized financially, and it's a lot of money, penalized financially if they don't improve the quality of care that's provided to their patients. And there's going to be measuring systems that are imposed starting in 2012 on all hospitals in the United States. And if your hospital falls in the lowest quartile, you're going to get penalized. That hospital is going to be penalized financially. 2, readmissions. If there's an unplanned readmission to hospital, happens all the time. But hospitals are going to be penalized financially if your readmission rate is on average lower, if you're, again, in the lowest quartile in the United States as hospitals. And then 3, hospital-acquired conditions. Like you pick up something that you shouldn't have had in the hospital. And these conditions are going to be monitored. And again, if you're a hospital in the lowest quartile and you got too many people picking up infections and whatnot in your hospital, you're going to be penalized financially. If you don't think that changes behavior at hospitals, you're not thinking right, because it will. It will dramatically change the way hospitals do business, and physicians, and nurses, and everybody else that works there. So I'm not going to go into all of that this morning. There's too much to cover otherwise. But the point is there are a lot of things going on in healthcare, in the law, that are substantially going to change the way healthcare is provided in the United States. Now, there's a lot of things about healthcare reform that we like, believe it or not. There's a lot of things that we like as Americans. A lot of it has to do with the insurance reforms. And I'm not going to go through each one of these. You might be able to read them if I'm not standing in your way here. There are a number of things. They're just the top one, for example, the elimination of pre-existing conditions. By 2014, you can't be denied coverage because of a pre-existing condition. Most Americans applaud that. In fact, that's one of the reasons you're thinking, well, that's why we were supposed to get health care reform in the first place, is to make sure that people who needed health care insurance could get it, regardless of their condition. We're spreading the risk. Spreading the risk. And that's what we thought insurance was supposed to be about in the first place, was maximum risk spreading. And insurance didn't turn out to be like that. Insurers like to minimize risk spreading. They make more money that way. But the point is that there are a number of things that are changed that most people really like about health care reform. This end of rescissions. Insurance providers can no longer drop an individual when he or she gets sick. Did that happen? Absolutely it happened. It happened by the thousands every year across the United States. For years and years and years it happened. And it got so bad that people said, you know what, we need to stop that. That's part of health care reform. Most Americans like that. Most people like the fact that when you get insurance, you think you're covered until you tell them you're sick and then you're not covered anymore. That changes. All of these changes, by the way, that I'm talking here in insurance, some of these actually started in 2010, in September of 2010. for brand new health plans that were started after that date. Most people are not in a brand new health care plan, so most of these changes actually take effect for everybody in America in 2014. 2014 is the big year in health care reform. There are many, many, many changes that I'm talking about today that don't take effect until 2014, especially the coverage issues, how many people are going to get covered and how they're going to be covered in health care reform. Other things, again, that we like about health care reform: insurance providers would be prohibited from requiring a referral to see an obstetrician or gynecologist. Those kinds of things, oh, well, gee, I thought that was current law anyway. No, it's not. So these are the kinds of things that are going to be implemented. They're in the process of being implemented right now and will be fully implemented in 2014. The individual mandate. This is not something that everybody likes. This is probably the issue that has gotten the most attention from certainly a legal perspective. As you know, health care reform is under challenge in the federal courts, which I'll talk about in a moment. But the individual mandate very simply says if you decide I don't want to be covered, it's going to cost you about $695. That's your penalty. And for a family, per family, a maximum of just over $2,000. Penalty if you don't want to be covered. So you don't have to be covered. Now, $695 doesn't sound like a lot of money to me. Individual making $40,000 a year, let's say, young, in good health, gee, I'd rather pay $695 penalty than I would a couple $1,000s for the insurance coverage that I could get. And that's why the number you saw earlier, it's anticipated that 24 million Americans are going to be not insured by 2019 because they're going to say, I'd rather pay the penalty. Huge debate in Congress, by the way, over what that number should be. A lot of people are saying, well, we need to really penalize heavily. Let's make that $695, let's make it $5,000. That'll make sure people sign up for health insurance. You know, in the end, and there were some people who said, no, you shouldn't be penalized at all. So in the end, the compromise was $600, and that's a wonderful thing about compromise. So $695 is the number that is the penalty on the individual mandate. Now, the individual mandate, as I mentioned, is the thing that is really driving a lot of the court issues. So a lot of you may be thinking, I hate this health care reform stuff. I wish it were repealed. Maybe they can get this repealed through the Congress. That's why I voted for all these Republicans, a lot of them Tea Party folks, to come into the Congress and do some things differently. Well, as you're probably aware, the House of Representatives has voted twice now. The new majority has voted twice to repeal health care reform. All the Republicans voted to repeal health care reform. It passed the House of Representatives. And of course, who runs the Senate? Oh yeah, the Democrats. Harry Reid runs the Senate. And he said, well, of course, the House bill is dead on arrival in the United States Senate. Although they did vote, you need 60 votes, remember, to do anything big in the Senate. They did vote on repeal, and it failed. I think it got about 50 votes, might have gotten 49 votes, less than a majority in the Senate to repeal health care reform. So as you can see, unless they're in the next election, unless there's a big change in the Senate, health care reform repeal will not happen. And with the president said he would veto any health care reform repeal bill that made his desk. So until the president is no longer the president, and that won't happen until, at the earliest, January of 2013, and that's if he's not reelected. So by January 2013, if Republicans, let's say, control everything, and a new Republican president, let's say President Trump, says I will sign that repeal bill when it reaches my desk, then it'll happen. But by that time, 75% of health care reform is already implemented around the United States. And a lot of the benefits of health care reform are already being enjoyed by a majority of the American people. So this is why people are saying, you know what, we may not like it, we're ambivalent about it, it doesn't really affect me, I don't like it, let's move on though. Let's move on. Now, there's an effort in the courts as well to get this thing thrown out, or declared unconstitutional. Right now, there are 5 decisions that have been made by federal district courts around the country, 3 for health care reform and 2 against. I don't know if it means anything or not. The Supreme Court announced yesterday that they are not going to allow the Virginia decision on this, the Virginia court decision, to be heard by the Supreme Court itself in an expedited process, meaning the earliest now it probably can reach the Supreme Court is at the end of 2012. So those of you who are hoping for health care reform, you're just going to have to wait a little while longer if it will ever happen. If it will ever happen. So that gives you a little bit of an idea about how this is playing out. Now, the Republicans haven't been real excited about health care reform, and they have a response. At the end of last year, right before the election, after the election, they put together basically a plank. Here's what we stand for on health care reform: repeal. On repeal, the first was repeal it and then replace it. Replace it with something. And they had several principles, the things that they would like to see in health care reform after we repeal what we have right now. The first is enact medical liability reform. One of the biggest mistakes in the healthcare reform law that was made was they didn't ignore it, but they completely ignored medical liability reform, tort reform. Everybody, every normal, rational person understands that the medical liability system in the United States is broken. You know, and we call it the kitchen sink syndrome, or new kitchen syndrome, and that is that you know, hospitals and physicians are sued all the time, particularly by Medicaid patients, simply because the settlement equals a number that's almost like a new kitchen. What they could get to have a new kitchen or a new boat. So, you know, there's a huge problem with medical liability in the United States, no question about it. Now, of course, we're talking about the Democrats who were in complete control when medical liability reform and health care reform were being debated. And one of the strongest lobbies in Washington is the trial lawyers. The trial bar, very, very powerful. They spend a lot of money on a lot of politicians, mostly Democrats, and they're very successful in their efforts. Now, before all you Republicans get a little too, you know, feel like you want to gloat over your Democratic friends over the idiocy of this, when the Republicans controlled the White House, the House, and the Senate, they couldn't get it done either. The Republicans were 2 votes shy in the United States Senate to get to 60 to have meaningful liability reform when George Bush was president. So we haven't been able to do medical liability reform the way it needs to be done, and everybody recognizes that it's worth at least $60 billion over 10 years. More people believe it's much more than that because it's been ingrained into our healthcare providers, physicians and hospitals, nurses, whatnot, that, gee, I better do a lot of stuff I really don't need to do, but it's more CYA than anything else, and that's built into the system. We need to take it out of the system. Republicans would like to do that. Purchase health care insurance across state lines. I don't know how this works exactly. So you're on the internet one night, and you see this ad pop up from Florida says, for $4.95 a month, we can give you complete coverage. That's the insurance I want. Okay? Obviously, your hospitals and doctors wouldn't take that insurance here. So I don't know how this works exactly. There needs to be a lot more work done in that area. Expand health savings accounts. Health savings accounts are great. My business uses only health savings accounts system with our employees. It's wonderful if you're relatively healthy and relatively young. It's great. But have any problems, serious problems, health savings accounts may not be the answer for you. Strengthen the doctor-patient relationship. This I want to see in writing in a piece of legislation. I don't know how you do that exactly, but I think it's wonderful. And then where Republicans and Democrats generally agree is on this pre-existing condition issue. Now, the Republicans don't go as far as the Democrats on this issue of insurance reform. The Republicans are more free market oriented, want to let the insurance industry kind of figure it out for themselves to do what's good for people. Democrats say they had their chance, now we got to make them do certain things, which is what you see now in the healthcare reform law itself. But at least the Republicans are looking at this saying, you know what, we think pre-existing conditions and probably the rescission issue ought to be dealt with. So this is basically where the GOP continues to stand today. The last one is permanently prohibit taxpayer funding of abortion. There's been a lot of legislation introduced and passed in the House on the abortion question this year alone. Now, what has actually happened? Your Congressman Ryan, well, your Wisconsin's Congressman Paul Ryan, great mind in the House of Representatives, no question about it. You've seen all the numbers here. We have a serious problem, Medicare and Medicaid. Medicare and Medicaid, Social Security, they're driving the federal budget deficit, the long-term deficit problem. They're driving it. There's no question about that because of because of where our nation is demographically. So their plan in the budget essentially was to radically, and I do mean radically, and I don't mean that as a political statement, it's a radical departure. The plan that they have proposed and voted on, as you see, all but four Republicans voted for this budget in the House of Representatives. They would radically change how Medicare is structured, particularly as it relates to people who are on Medicare. Not today necessarily, but I mean, it doesn't change the system of delivery of care. It changes Medicare itself. It goes from a defined benefit plan to a defined contribution plan. Those of you who deal with those kinds of issues understand that. So the government ends up, the first year that this starts, government pays about $8,000 a year for people to be in Medicare, essentially. That's an average. In high-cost areas, it would be higher than that. In low-cost areas, it might be less than that. But that's the number that they're pegging right now, pegging the budget number to, and that's $8,000 a year. A lot of people say, well, that may be good the first year, but what happens when costs go up? Who pays for that? Well, seniors pay for that out of their own pocket. And so that's why you see a lot of the news coverage today. People are concerned. People are very concerned about this. The polling on this, again, this is not a commentary on Congressman Ryan or the plan itself. I'm just making an observation of where the American people seem to be. Basically, the American people are here's the problem. It's very simple. Americans, uniquely in the world, have this viewpoint. It's a vertical and a horizontal view, and Americans hold these views simultaneously. So think of yourself in this situation. The vertical view of healthcare is when you're feeling good, feeling fine. When you think about healthcare, the first thing you think about is it costs too much money. The horizontal view, maybe you're ahead of me here a little bit, when you or a loved one are flat on your back, the first thing you think about when it comes to healthcare is, I don't care what it costs, do whatever it takes. That's us. You know, no other culture in the world holds that view. So you send these guys to Washington to fix it. What are they supposed to do? You know, it either costs too much or do whatever it takes. What do? You try to find some compromise in all of that, and that's what we're struggling with today as a culture. So Ryan's got a plan. Most of the Republicans voted for it. Dramatically changes Medicare. I'm not going to go through all of the provisions on this. There are a lot of issues. It wouldn't take effect for people who are 55 years and older now. It wouldn't affect them, but people who are younger. And you've seen the polling on this. Americans, by anywhere from 65 to 85%, depending on how the question is asked, are saying, I don't like this plan. Even if I am on Medicare today, I don't like this for my kids. Because a few people remember before 1965, 64, 65, when Medicare was created, seniors didn't have, a lot of seniors could not get insurance coverage. Why? Because nobody wanted to cover them because they were sick. Why? Because they were old. Well, you know, so that's why we have Medicare and Medicaid today. Well, that's not why we have Medicaid. I'll talk about that in a minute. But Medicare, that's why we have Medicare today. And so if the contract changes and private insurance companies have a lot more say in who is and who isn't covered and what benefits are covered or not, well, maybe there are a lot of seniors that wouldn't have coverage in the future. That's what people are concerned about. So there's a big debate. You're involved in it. Everybody's involved in it. What's going on? How is this going to play out over the next couple of years? Are we going to change Medicare this dramatically or not? But there are a lot of significant changes to it. Medicaid. Medicaid is growing faster than Medicare as a percentage of the overall budget. Medicaid is the health insurance program for the poor. One of the reasons Medicaid has grown so dramatically in the last couple of years is because of the economy. More people losing their jobs qualify for Medicaid, and they get a lot of really good benefits. A lot of very good benefits. Under the Ryan plan, Medicaid changes dramatically. Again, the idea being that we can't sustain the growth in Medicaid the way we've done over the last 10, 15 years. It's got to change dramatically. So what do? Under this plan, essentially, there's about $771 billion cut out of Medicaid over the next 10 years, and states are given broad unilateral authority to design health care programs for their own poor people. Now, one of the reasons why the Medicaid proposal is popular is because poor people don't vote. I'm being a little crass about this. But in fact, that constituency, generally speaking, is not very politically active. So it's easy, relatively speaking, to go after them. That's what the folks who oppose this plan are saying, in large part. Simultaneously, healthcare providers, hospitals, for example, that have emergency departments that are required by law to treat anybody and everybody that walks into that emergency department. Doesn't mean they give them a facelift if they want it. It means if there's any kind of an emergency, they have to treat it, regardless of that patient's ability to pay. What providers see with this is, oh my goodness, we've got a much larger unfunded mandate. We're going to continue to provide virtually the same amount of care, but we're going to get paid a lot less to do it. What does that mean for you? It means your rates will go up, or there'll be a lot of pressure to cost shift into other areas, which is what goes on today. So it is a dramatic change. So this is where the Republican Party is going, and of course, the Senate. Now, who controls the Senate again? Oh, yeah. Harry Reid said, this budget isn't going to get a vote in the United States Senate. It isn't going to happen because I think it's irresponsible. So you can see, they're set up not to agree on this budget this year. A couple of other points about the House Republican plan. There is no cost containment reform in there. But what Ryan does do is he relies on all these demonstration and pilot programs that are in the current health care reform law to continue to go forward, and all of the cuts that I talked about earlier in health care reform, those are also included in the Ryan budget. So there are some other cuts in there in Medicare, specifically just because he allows the current health care reform law or portions of it to move forward. Everything else would be repealed. Also, there's no fix for Medicare payments to physicians. I don't know how many of you are aware of this, but over the last 2 or 3 years, the federal government has been, because of a formula that was developed about 10 years, in fact, it was in 1997 when the formula was developed on how to pay physicians for the care they provide Medicare patients. That formula hasn't changed since 1997, and the unintended consequence of that formula is that if the Congress doesn't keep changing the caps that are in that formula, physicians are going to see a huge pay cut for treating Medicare patients. Huge. We're talking on January 1 of this next year, 2012, January 1, if it's not fixed, physicians will see a 30% pay cut from Medicare. Now, how many physicians that you know are going to want to take care of Medicare patients if that happens? This has been going on now for about 4 or 5, it's been going on since 1997, but it's become more acute because of the way the formula works over the last 4 years. This chart shows, this is the growth of the population age 65 and older in the United States. This is 2025 out here. The average growth in population of America overall, this is the little blue dots right there are the number of physicians. The growth in the number of physicians in the United States. So you can see that there might be a little bit of a problem developing here. A lot of people think today, depending on your community, what community you live in, it's a crisis. So what are doctors doing across the United States? They're not taking Medicare patients anymore. It's a be over 65 today on Medicare, depending on Medicare, and move to a different community. Just try it. Well, not you personally necessarily, but it's a serious problem. It's hard to find. Look at these numbers. These are kind of disturbing numbers. American Academy of Family Physicians says 13% of respondents didn't participate in Medicare last year, up from 8% in 08, 6% in 04. Osteopathic Association says 15% don't participate in Medicare, 19% don't accept new Medicare patients. American Medical Association says 17%, but among primary care physicians, 31% not taking Medicare patients anymore. Federal health insurance program for seniors, which is Medicare, paid doctors on average 78% of what private insurers paid in 2008. So we've got this aging population, we need more services, we have this problem, and now we have physicians that we're not going to pay for taking care of us as we get older. Yeah, I know. Are you happy now? Did I cheer you up this morning? You know, it's a terrible situation. And I just wanted to mention to you because it's affecting all of us. Nothing in healthcare reform and nothing that's being proposed as an alternative to healthcare reform is dealing with this problem today. Nothing. Nothing. I don't know, you know, Mike was talking about his crystal ball. Mine is as foggy as it's ever been. But nothing is out there to deal with this today. So, you know, but it's a problem. It's a huge problem. Let me talk specifically now about healthcare reform and impact on business. And I could spend another 3 hours and really put you to sleep on this, so I'm going to gloss over a lot of stuff here and try to move this rather quickly just to give you some sense of what's going to happen in healthcare reform as it relates to businesses, because there's a lot in healthcare reform as it relates to business, particularly small business, but business period. Grandfathered plans. Now, I'm not going to act like your insurance guy and come in and tell you the difference between what is and isn't a grandfather plan. There's a lot of definition associated with this, and a lot of it is on this slide, essentially. But remember when the president said anybody who has the health care plan that they're in, they like it, they can keep it? Essentially, that's what this is. There are, in fact, if you're in a health insurance plan where there are no changes to that plan from year to year, you can stay in that plan. No changes to that plan will happen with a couple of minor, significant exceptions, but still overall, no change to that plan. If you like it, you can keep what you have. That's a grandfathered plan. There are some exceptions to that, and I've got bulleted here some things that are exceptions in those grandfathered plans, but they're designed to help you as the consumer. They might cost the business more, they might cost the insurer a little bit more, but they're designed to help the consumer more than anything else. Grandfather plans. Now, when we talk about, there are a lot of other kinds of plans. Self-funded ERISA plans, Employee Retirement Income Security Act plans that are, a lot of exemptions to that. As you can see here, that the health care reform law specifically does not apply to self-funded ERISA plans for certain provisions. And I've listed these provisions here. And if you want me to go into some greater detail on this, I will. These slides are available to you as well. If you want copies of these slides, you can get them from Mike, from the hospital. But the point here is that a number of exceptions were made to try to help. And this is why in America today, if you work for a company that has a pretty decent health plan, for the most part, you've been largely unaffected by health care reform, period. How many people here have actually been personally impacted by the new health care reform law? Let me see a show of hands. There might be a few in here. Either you're real shy or nobody, right? So, I mean, the point is that there are, of all the changes that were made, the changes that are the least obtrusive to most people are for individuals who are employed with a health plan that they kind of like. And so the self-funded plans, again, there are some changes that were made, not very many. Again, if your self-funded plan is not grandfathered or it loses its grandfathered status, the plan will be subject to all of the rules applicable to group health plans, including all the provisions and so on and so forth. So in other words, if you're not grandfathered, then depending on if you're in a ERISA plan and you're not grandfathered, you're not considered grandfathered, you're going to have to comply with all the rules. Your plan will have to comply with all the rules. I mentioned a number of these rules earlier about rescission authority and pre-existing conditions and stuff like that. All of those things are going to apply to all of these health plans that are not grandfathered or ERISA plans that are not grandfathered as well. One of the most significant changes that's going to happen as it relates to health insurance and coverage for your business is the implementation of state health exchanges. Now, there's two things I want to mention. There are the what they call American Health Benefit Exchanges. That's what you see written about mostly in the news today. This is what states are dealing with today. Should we create our own exchange, or should we let the federal government and create our exchange for us? That's a debate going on in Wisconsin and every other state right now as well. In addition to that, there are small business health option program exchanges. SHOP is what it's called. And they're specifically designed for small businesses, businesses under 100 employees, essentially. Here's what the bottom line is on what these exchanges are. Come 2014, if you decide, let's say your business, and you decide, you know what, I'm going to run the numbers on this and try to figure this out. I wonder if it's cheaper for me as a business to let all my employees do whatever they want when it comes to the insurance that they get. In other words, drop the benefit that I have as an employer. More than likely, if you run the numbers, depending on your situation, but more than likely, most employers will find that it's cheaper to drop the benefit. It's cheaper to drop the benefit. And that means that your employees would go online into one of these two exchanges, and they would be able to compare, perhaps for the first time, in some kind of logical way, compare all the healthcare insurance options available to them and the costs associated with each. That's what these exchanges are all about. And under the law, these exchanges are required to set up a variety of defined benefits in each. So for example, you'll have a gold plan, a silver plan, a bronze plan, and a platinum plan, maybe at the top. And each plan is going to cost X amount of dollars. That will not be prescribed. There'll be a certain range in which the costs will be associated with each plan. But insurers are going to be able, these are private insurance options now. These are not government insurance options. These are private insurance offerings that will come through this national or state exchange. I'm sorry, it's not national, it's a state exchange. And employees or individuals that qualify will be able to go, again, online and choose which one they want. Depending on their situation, their income, they may be eligible for a subsidy as well from the government to help pay for their insurance. Or the employer may say, look, I'm just going to let you all go, and I'm going to help if I'm going to drop this benefit. As an employer, I'm going to drop this benefit, the health insurance benefit, and I may provide some other kind of subsidy for you as well as an employer. There's a limited ability to be able to do that, particularly for small businesses. So essentially, millions, it's anticipated, millions of Americans are either going to lose their benefits through their employer or qualify otherwise to be able to shop for their insurance through the exchange. Have I made it really as clear as mud at this point about what these exchanges are? They're complicated because we're setting them up now, and every state has the right to create their own exchange, and the federal government